So I want to share some specific tips that will help grow the whitening business in your practice. All right, tip number one, start by taking a shade match of your hygiene patient. Your hygienist will take a shade match at the beginning of the hygiene appointment. So we take a shade match, and it goes something like this. I'll role play as if I'm the hygienist, Naren, and you're my patient. Hey, Naren, I'm going to do something a little bit different at the beginning of our hygiene appointment today. I'm going to start by taking a shade match of your current tooth color. And the reason we're doing this now, Naren, is that we know that tooth color changes over time. It tends to darken with age. I'd like to have that for our records. And we grab a Vita shade guide and we take a shade match. By the way, that shade match should take about 15 seconds to take. So then I go to tip number two. Once we have the shade match, I now show it to the patient on the Vita shade guide, organized chromatically from dark to light, So we organize that shade guide chromatically. And now I'm going to say, hey, Naren, let me show you the current tooth color that you have here on the shade guide. I've organized this from dark to light, and you're about right here. Now, trivia question. What is the average adult American's tooth color on the Vita shade guide if they've never had their teeth whitened? It's A 3.5, A 3.5. And for those of you that know what the chromatic ordering of the Vita shade guide looks like, if I look at that, it's ordered 2/3 of the way down the scale towards dark. So now we simply show the patient, hey, Naren, I just want to show you where you are. I've organized this from dark to light. You're about right here. And again, that would be 2/3 of the way down the scale. What do you think most people are going to say when they see where they are, where their color scale is? What do you think most people will say?
I think, do they underestimate or overestimate where they are?
Wow, I could get whiter teeth, couldn't I?
Right. So they're always looking at what's missing, right? What they don't have.
Yeah, they want what they look at what they want.
Right.
And now when they see where they are compared to what they could have, they want this. Right. They want it. And then we can simply, it's a door opener. It's an icebreaker. Hey, Naren, just so you know, we have 3 forms of whitening here in the practice. If you'd like us to do the whitening for you, we can do it chairside. We also can make custom trays that you can use at home. We can provide you with the material to do your whitening at home. We also have a simple, inexpensive whitening product that is available here in our office that you can take home. It's very simple. It's very inexpensive. It's only available in a dental office. And that's an option as well. If you have any interest, let me know and I can walk through with you what might be the best option for you. So tip number 3 is I do think it makes sense to offer 3 forms of whitening in your practice. A chairside whitening option, something that you do for the patient. A couple of options that kind of come to mind would be Philips Zoom using the lamp. Ultradent has a great product for chairside whitening as well. They call it Boost as well. I like Ultradent products an awful lot. So we can do chairside whitening. A second option would be custom trays, where we do take-home trays. Again, some options there. Again, sticking with the 2 chairside options I've presented, we can continue to use the Philips Zoom products in take-home form. Those are available, night white, day white, and also Ultradent opalescence products can be done for take-home trays. Again, if you have other vendors that you like, use the flavor that you prefer, for sure. And then for a simple, inexpensive over-the-counter product, I like offering, again, I'll stick with Ultradent here, their Go product. Go is prefabricated trays. It's a dual tray setup where the patient pops the 2 trays into their mouth. It comes together and they pop them in their mouth. Then once it's in the mouth, they take out the outer tray, which leaves a very thin inner tray that's been preloaded with gel. It's called Go. It's a fantastic product. One of the things I really like about Go is that Dr. Dan Fisher, the founder of Ultradent, dentist, a wonderful, wonderful human being, a great dentist, an amazing human being. When Dan came up with the Go product, he had an opportunity to put that in retail stores, put it in Walmart, put it in Target, put it in all the Walgreens and all the drugstores. He chose not to do that because he wanted whitening to be professionally supervised. And I have to give Dan massive ethical credit for that. And I agree. I think whitening should be professionally supervised because, for example, Naren, if you have any decay that perhaps is not, you're not experiencing any pain, but you have decay, we're going to want to get that decay taken care of before we do whitening. And so that's not going to happen if you can just go to Walgreens and pick up a whitening product. So I think the idea of having it professionally supervised is a great result. All right, third tip, offer 3 forms of whitening. Tip number 4, consider offering lifetime whitening. Lifetime whitening. Now, stick with me on this for just a minute. For our chairside whitening, we're always going to make a set of custom trays so they can continue the process at home. And of course, for our take-home trays, we make a set of custom trays. So those patients are going to have a permanent set of trays. This doesn't apply to Go because those aren't permanent. Those, after we put them in the mouth, they're disposable. They're not permanent. So if the patient has a permanent set of trays, we offer lifetime whitening. And what that means is, as long as they keep the recommended hygiene appointments, we're going to give them free gel so they can continue to touch up whitening after their hygiene appointments. And I like to get the syringes from Ultradent. Dan puts anything he can in a syringe, and he puts the whitening product in a syringe. It makes it very easy to load the trays. Now, when the patient, as long as they keep their recommended hygiene appointments or give us 48 hours advance notice if they need to change it, they stay in our lifetime whitening program. So offer lifetime whitening. You're giving people what they want. 1 syringe will typically be useful for 4 applications of the trays. For most people, that's enough to get a nice kind of touch up on their whitening, at least for most people that have a relatively moderate food or drink habits on food or drink that causes stain. Coffee, tea, anything that would stain a white shirt will stain people's teeth. Now, if someone has more aggressive coffee habits, like they drink 3 or 4 cups a day, or tea, or they enjoy spaghetti multiple times a week, then we'd provide them with 2 syringes, 1 or 2. If they want more than that, then they can buy those from you at a price that you determine. And then finally, tip number 5, consider value pricing whitening. It's the only service that I recommend to my clients that they value price. But consider value pricing, because the concept of value pricing is if you make it less expensive, you'll do more of it, and it'll lead to more gateway patients for us. So rather than trying to use it as a profit center, which as a business person I am in favor of, I would rather value price it so we can do a lot more. For example, recommended pricing, again, you can decide, but I'll share with you when clients ask, hey, Gary, when you talk about value pricing, what do you mean? I would say for your chairside solution, make it something less than $300, $297, for example. If you do Zoom or you do the Opalescence Boost, that will be considerably less expensive than it is in other dental offices around your area. It's still profitable at that, marginally. You're covering your expenses, really. As far as take-home trays, I'd recommend $100 less expensive than chairside. So if you're doing $297 for chairside, I would make that $197 for custom trays. And then if we're offering the Go product, it comes in a box of 10. You pay $32 for that box. And I would suggest that maybe a value priced for that box of 10 would be $50, Aaron, $50. So $297, $197, and $50. And I believe by offering those price points, you literally have a price point for virtually anybody in your practice, And now you might ask, Gary, what would be an appropriate goal then? And let me tell you where I would like you to get. And this is what I shoot for with my clients. I'd like you to get to the point where you're doing 1 whitening procedure a day, a work day in your practice. So if you're working 20 days a month, I'd like to see us get 20, whitening patients. And by the way, any of those 3 counts. It counts if we do chairside, Counts if we do take home trays, and it counts if we hand them a box of Go. All those count. And my goal would be to get to 20. But Naren, if the average is 1.2 whitening procedures a month, do you think we're going to go to 20 overnight?
No, we are not. So I think it's better to start smaller, right? That's a big jump from 1 to 20.
And I might argue that that's too big of a jump. It's not that you couldn't do it, but it's not very likely. But start somewhere. And where I'd encourage you to start is somewhere between 5 and 10 whitening procedures a month. Somewhere between 5 and 10. If you're the kind of person that likes to have a stretch goal, start at 10. If you're the kind of person who wants to have a safe goal, start at 5.